Nigeria, it is the beginning of the hot season after a couple of months of dry and windy harmattan. Now, most Nigerians don't like the heat ordinarily and will do all they can to avoid it. But when you get warnings about a looming heat wave, it gets scary. It also does not help that the life of an average Nigerian is characterized by daily hustles. And so we must deal with what nature throws at us. Some will say the result of what we gave to nature. So what is this news about a looming heat wave in Nigeria? Should we be worried? And what are the stakes? These are some of the questions we will be seeking answers to on Nigeria Today. My name is Joy Osiago. Welcome to the program. With me in the studio to look at the news circulating about heat waves in Nigeria is the General Manager, Network of Stations of Nigeria Meteorological Agency, Abdul Rashid Zakari, to my immediate left. You're welcome to the studio and thanks for joining us. Also in the studio to provide health perspective to the talk is a physician, Dr. Ayo Olusanya David, to my far left.
Thank you very much.
Gentlemen, thanks for joining us.
You're welcome.
Now, it is no longer news that the country is currently experiencing heat waves, and we've gotten news about that on social media and all that. Let me start with you, Mr. Abdul Rashid. What are the weather prospects for Nigeria in 2018?
Thank you very much for inviting me. First, I would like to correct the trends. There's the media from the social media.
The news circulating about heat waves?
The social media about the heat waves across the country. First, we would like to let the general public know that this was an expression or what we experienced some years back. This is not emanating from Nigerian Meteorological Agency. Notwithstanding, the Nigerian Meteorological Agency at the beginning of every year, we have what we call the annual rainfall prediction. And from the annual rainfall prediction, we give the details on the entire weather condition across the country, be it the rainfall, the temperature, and what have you. So for the 2018, the one you asked now, as regards what we are expecting, well, we have not yet released the 2018 seasonal rainfall prediction. Okay. It's not yet released. Hopefully by maybe end of next month or middle of the month. Notwithstanding, from the present synoptic situation, that's what we are observing across the country so far. Before I left my office, I was at the Central Forecast Office where we carry out our daily weather presentation. What we saw is that we have influx of southwesterly winds, and these are moist winds, but they are warm at this time of the year. And usually at the beginning of the rainy season, we observe these southwesterly winds now dominating. Initially, as you mentioned at the beginning of the program, during the harmattans, the northeasterly winds were predominant. Now we are expecting that as time goes on, the southwesterlies will take over the rain across the country. So as they are coming into the country, they are carrying in moisture. But these moist winds are warm. That is why people are becoming uncomfortable.
Well, it's been pretty warm for the past 2 days. I guess people are being proactive. Probably they've been waiting to hear from you, and because they didn't, they're already telling people what to do. Yeah, well, NIMET have done its own bit. We have the daily weather presentation with the NTA is part of the presentation on daily after the network news. And I knew, even before I left the station, some of my presenters, I asked them, they said what they predicted over the last 2-3 days came to fruition. Like for instance, areas around the southwest, Ekom, Ogoja, and the rest of them, they had some rain, but notwithstanding, the temperature rise around 38 to around 39 degrees, which, as I've said initially, is because of that southwesterly moist winds. Most of the times, people are not so conscious of this our daily weather presentation. That's why we emphasized
people should listen to our daily weather presentation.
Now, I was just going to go to that. You know, the weather presentation, most times the forecast, they are on television. How many people have access to television? I mean, what are the other means of reaching out to people, especially in the rural areas and densely populated areas?
Yes, well, the agency, through the effort of the present Director General, Professor Sani Mashi, is making efforts now that we will have access to the rural people through the use of radio messaging, and it's what is on the burner now. The agency is trying to see that the people in the rural areas are advised, because most of the times, even especially when it comes to rainfall related issues, people in the rural areas are those are into agriculture. So NIMET is collaborating with the agri institutions and then some other media institutions, organizations, to assist. Although the mandate given to NIMET is to tell the public or to tell the generality, the country, that this is what is expected, giving warnings to the people. To get to the roots, then the media houses, which the NTA is expected to participate, the National Orientation Agency, which I saw one of the what do you call the trending information on the heat waves, will have to collaborate with Nigerian Meteorological Agency. We do the scientific investigation, and then they will assist the media houses now to disseminate such information to the public. I believe it's a teamwork.
All right, let's go to Dr. Ayo. Let's hear a bit about what we should be doing, because this is just the beginning, and we know that this will continue for a while. What should we be doing in terms of precautionary measures?
Thank you very much. First of all, heat is not a very good thing. Now, the major reason is because our bodies rely on water to function. Now, when it's too hot, we lose a lot of water. We end up getting dehydrated. Now, what are some of the ways in which we lose water? When we breathe, we lose water. When we sweat, we lose water. When we go to the bathroom to urinate or to defecate, we lose water. Every step of the way, we lose water. Now, imagine when the temperatures are higher. Our body has a cooling mechanism whereby when we sweat, the sweat evaporates and tries to cool us down, so that we do not feel so hot at the end of the day. Now, all this put together helps us to function on a daily basis, even down to the cellular level. Now, having said that, it is very important that we keep our basic body functions going. What do I mean? Based on the fact that we are losing water when it's really hot, we need to make sure that we replace what we are losing. So every day, we need to ensure that we drink a lot of water. Now, normally, when it's not so hot, regular weather, we recommend that we take at least 3 liters of water a day. Now, when it's really hot, we lose more water, definitely. So we have to take much more than 3 liters of water a day. Now, it's not like you should rush the water every single time, but to remind yourself that you should take water, always have a bottle of water with you at every step of the way during the day. Secondly, we should make sure we wear light clothing. This is to help our bodies to adjust to the weather. Thirdly, spend as much time indoors as possible where you are not exposed to the sun. With regards to children and elderly people, we always have to ensure that they are also hydrated, drinking a lot of water.
Because usually they are the ones who are
the vulnerable ones, exactly. And most of them can't speak for themselves. Now, when it comes to those who are already ill, it's the same thing. We need to ensure we hydrate. Now, our foods are also very important. What we eat, what we consume. It is important that we consume water-based foods during this period. Now, let's talk about fruits. It's important that we consume fruits like watermelon, oranges, fruits that basically have a lot of water in them. So it's not just that we are getting nutrition from them, we are also getting rehydrated from those fruits as well. If we can afford an air condition, spend as much time under an air condition as possible. It's not being a debota. It's basically trying to save your own self, trying to make sure your body functions adequately.
Thank you very much. Mr. Abdul Rashid, usually when we have these kinds of warning about heat, we know that this comes with flood situation, especially when we get into the raining season. For this year, what should we expect?
I will still maintain my stand, as I've said initially. The Nigerian Meteorological Agency have not yet released the 2018 seasonal rainfall prediction, so I won't want to preempt. But notwithstanding, as we get into the rainy season, definitely the issue of floods has been a topical issue in this country. But the agency always come up with early warning advisories to the public, especially to those people who are staying along the flood-prone areas. For now, I will keep it to myself. When the 2018 seasonal rainfall prediction is released, then we can point out places where we expect such floods to take place, so that people will now take precautionary measures.
Now, I know that every year you come up with these warning signals, and each year we go into a new year with the same situation. By the way, let's start by looking at these predictions. Why are they taking too long?
Well, they are not really taking too long, because these are scientific scientific observations, and for you to have as accurate as expected of you, you need to take time to do your analysis, gather lots of information, that's the data that has to do with the prediction, and then you have to call the stakeholders too, because the Nigerian Meteorological is not just solely on its own come out to give the prediction. We call our stakeholders, we sit down, we look at it scientifically, and the stakeholders too have their own inputs. People from the agric, from water resources, hydrology, and the rest of them. Now these people are not only are they professionals in their own fields, but they have their own findings too. Then when we put all these things together, we then come out to the public to give the seasonal rainfall prediction. Now,
you do this annually. What are some of the plans you have put in place to check this problem? Because this is something we experience every year.
That's the floods? Or
yes.
Yeah, well, on our own part, as I've said, ours is to say point A or state A and B and C will experience floods. Now it's left for the people now to make up their minds whether to remain in such places or not to. So the other agencies or stakeholders, like the Nigerian National Nigerian Emergency Management Agency, that's the NEMA, the NOAA, the NTA itself, will all have to join hands to keep enlightening people that staying in such flood-prone areas is not good for them.
So where do you expect them to move to?
Oh, well, that one now has to do with policy formulation.
Which brings me back to the question. I was referring to the issue of policy formulation, since these are some of the challenges you experience yearly. At this stage in Nigeria, shouldn't we have a perfect or a working policy that we can use to deal with subsequent situations?
There are. Ours, we are limited. Ours is to advise the government. Now is left for the government now to make use of our advice based on our findings to work on. Notwithstanding, you see, an average person, most of the times the question asked is, why don't people leave such flood-prone areas or areas that are weather front disaster areas? And as the question asks, where will those people go to if they should leave that? For Nigerian Meteorological Agency, we are limited to that advisories only.
All right, let's go to Dr. Ayo and let's continue about health implications. Looking at some of the predictions and the subsequent outcomes of the hot season, what should we be doing in terms of preparing ourselves for some of the ailments that come with this, like meningitis and all thankfully, medical science has gone so far in this day and age.
Just like you mentioned, meningitis, for example, has vaccines that we can take, and we can protect ourselves from any outbreak whatsoever. Now, it is important to note that around this time, most of these diseases spread faster because there is usually poor ventilation, especially those who stay in crowded rooms. Now, because there is poor ventilation, once these bacteria are released into the air, it's very easy for the next person to catch it. Basically, explaining it in layman's terms, there's no breeze to carry it away.
So what should the public health sector be doing to support all this, especially if you want to talk about how they can support the people?
Now, the public health sector needs to ensure that the vaccines are available and affordable. Those are two key issues that we have faced in recent past, especially with the last outbreak of meningitis A and D that we experienced just a few months ago. Availability is one thing, affordability is another thing. Now, once we ensure that the vaccines are available and affordable, then we can be rest assured that no matter the kind of meningitis outbreak that comes, viral, bacterial, no matter the strain, we are well protected against it.
All right. The program is Nigeria Today, and we have been looking at how to prepare for extreme weather conditions. It is time to take a break. The program continues shortly.
Coming up on NTA News 24, Nigeria Today, 7:30, Monday to Friday, with exciting anchors on topical issues. Inspirators, a search for those who inspire others. Business 24, a business magazine program. Late edition repackaged. Fresh and exciting programming on NTA News 24. Stay with us.
So staying with us. I'll start with you, Mr. Abdul Rashid. You know, we have looked at some of the challenges of this season. Let's look at the economic implications, especially when it comes to the rainy season and in terms of flooding, the impact on the economy.
Well, first and foremost, on the livelihoods of the people. Whenever we have this flood, I remember the last flood of 2012. I wouldn't want to quote the number, but quite a number of people lost their lives and their livelihoods, their properties. The farmlands were destroyed, and at the same time diseases, outbreak of diseases in such areas where we had that flood. For instance, in terms of the loss in agriculture, when we have such farmlands overflooded, the possibilities that crops that were produced or harvested around that period will have been lost, and is going to be in millions of naira.
And that's not good for the economy.
It can never be good for the economy, definitely. And then two, in terms of the health, when you have quite a number of people being attacked, like I was told at some point, there are issues of reptiles coming to even attack people, and such will have affected those people's activities in terms of maybe participating in their places of work or some other activities that will have given them opportunity to make income from such periods. Again, during that period of time, if of that floods, definitely we know it will have affected people from going to their places of work, because most of those places will have been destroyed, or what do you call now? The waters will have prevented people from going to maybe the markets, the schools, and other places of work. At a point, many people were migrating from places like Lokoja and a number of areas to the neighboring states. And in such situation, definitely, apart from the economic implication, there are possibility of even crime being on the increase. Because if somebody that is living on as a farmer, that is producing crops to for his maybe a subsistence farmer, or even if he's doing it to sell in the markets, and if he's not having such opportunity, definitely he may want to go into some other means to survive.
So it's NIMED working with the state government and even local government areas where we have this situation, those who are prone to this situation, to be proactive and act ahead before we face such situations.
NIMED is doing, for instance, we have Katsina State. It's one of the states in Nigeria that is collaborating with the agency, that they have their own, they scale down the seasonal rainfall prediction to just Katsina State, so that it will assist the state government to know which area in the state will have this much of amount of rain at this time of the year. Even if there is maybe possibility of floods, then the NIMED advise such. So, and NIMED is not restricting it to Katsina State. We are selling the idea, the agency is selling the idea to other states across the country. They downscale the seasonal rainfall prediction so that they go to states now, up to local governments. They do this in collaboration with the agric extension officers.
So what is the response from the Katsina state government? Is it positive?
Very positive. In fact, they appreciated our forecast to more than 80%. Yes, they did. And till today, they were having that MOU with the state.
All right, let me go to you, Dr. Ayo. Since we're talking about collaboration between the federal and state now, from the health perspective, what should we be doing, especially at the federal level and the state levels, in terms of collaborating? Because this is a huge situation that shouldn't be left in the hands of NIMED alone.
Of course, you're very correct. It's a huge situation. Now, just like he mentioned 2012, the last flood, the impact was really devastating, especially on the hospitals that we have. Now, let me remind us that we have 3 tiers when it comes to the health sector in Nigeria. We have the primary healthcare, secondary healthcare, and the tertiary healthcare. Now, the federal government can improve the primary healthcare system such that when these floods happen, the first victims can get treatment from the primary healthcare, and then whoever needs further attention can be transferred to the secondary healthcare, and whoever needs further attention can be transferred to the tertiary healthcare. Now, this reduces the load on the big hospitals. Another thing is distance. Most of the time, we all want to go to the big hospitals. Meanwhile, the primary healthcare is right next door to us. If the federal government can improve the primary healthcare system so well, we would not have a lot of these issues. The primary healthcare is also responsible for advocacy, responsible for teaching the community on how to be hygienic, how to survive things like flood. They are an institution that NIMED can collaborate with, train the people in the primary healthcare sector. Those ones will go into the communities and teach people what to expect.
How about in terms of the heat wave? What can they do? Because we just laid emphasis on the flood.
Yes, the heat wave as well. Advocacy is very important. I've noticed that a lot of us don't know what to do. Information is key. Once we know what to do, we are able to conquer whatever obstacle comes before us. Now, a lot of Nigerians don't know that you should have as much air as possible coming into your room at night. Most of the time, we are torn between choosing mosquito bites or choosing heat, and a lot of us end up choosing heat as the better option. It's not very correct. Now, teaching us what to do, teaching us how to live, something as simple as emphasizing washing your hands after every single action can go a very long way in saving lives. For example, in 2012, we had a very widespread case of typhoid during the last floods. Now, if the people around those affected communities and those who have been displaced were taught, were given the information on how to better manage their health despite their situation, we would have saved a lot of lives. Another thing that happened during that 2012 flood was, just like you said, reptiles. We had lots of snake bites. The water that came from the sea came with a lot of reptiles. Now, what the government should have done at that point was to provide what we call snake serums. It's basically an injection that helps against snake bites, which was not available. Anybody who had a snake bite at that point in time was basically on their own. You know, so little things like this, from step by step, can go a long way in saving lives. All
right, Dr. Time is against us. I have been speaking with the General Manager, Network of Stations of Nigeria Meteorological Agency, Mr. Abdulrasheed Zakariyahu. Mr. Zakariyahu, thanks for joining us in the studio. And also a health practitioner, Dr. Ayo Olusonya David. And that's Nigeria Today. Join us on Monday for a fresh edition. I am Joy Ziago.